Hi, Amy. My name is Tabithar Musa. I'm responding to your second discussion post on discussion board post on medication assisted treatment, MAT. You talked about how it's a controversial subject, and I do agree. The fact that we're having a discussion about this already shows that there are two different sides to the fence. There have been different opinions about this, and there also exists a body of study, evidence-based studies, to back up how efficient it's been. It's been there for a long time. MAT has been used for a long time, and you talked about its efficacy or use within two particular systems you're talking about, which is the drug court and the child welfare system. I found that very interesting because I didn't even think of it as far as going into those areas. But I do understand that it's efficient, or its efficiency is seen in how it helps the drug courts to decongest the prison system from overpopulation, from non-violent crimes, which is mostly what people with addiction deal with. So using MAT programmed treatments in collaboration with behavioral therapy or interventions has helped some of these addicts to gain sobriety. And you talked about the study as written by Mutusa 2013 that talked about 56% of participants addicted to opioid who were given this treatment, and there was a significant improvement in their recovery. This attests to the effectiveness of this program if done in collaboration with psychotherapy, not on its own. The second area in which you drew light to was child neglect and the family cuts the child welfare system, in which there are many kids that come into foster care that come from families or from homes that have been thrived with opioid abuse, and sometimes more foster parents might be more willing to get custody, um, or to take custody of the kids in the interim, if they are aware, or if they know that there is a possibility that these kids or these kids are going to receive medication intervention treatments as a way of detoxing them from the opioid environment they've been, or drug induced environment they've been in. And this also goes a long way for the parents, because there are chances that they could regain custody of their children if they are able to effectively undergo the treatment of medication assisted therapy, or treatments in conclusion or in addition to therapy, behavioral therapy. Some of what you raised was something I found very interesting, because on a good day I wouldn't I was thinking more in terms of it being utilized for adults as against children. Um, One of the things you talked about, that it helps medication assisted therapy, based on what I read, and according to Martin Hall, he did state that medication assisted treatment improves child permanency outcomes for opioid using family, especially while they're in the child welfare system, and that for those parents who use opioid, they know that there's a possibility of them losing custody of their children, these parents, through the use of MAT treatments and utilizing it, there's a higher possibility or probability of them regaining custody of their children. And it also helps with addressing family issues that has to do with substance abuse and child abuse and neglect issues. So there was a study done on the prevalence and correlation of mat utilization among parents in this program with a history of opioid use. And for the outcomes for children that came from these families who have received this medication assisted therapy, the outcome seems much more positive than those that did not go through the program. Those that just went through behavioral therapy, as against those who went through behavioral therapy or intervention in collaboration with the medications. So it can be said that MAT increases the odds of parents, substance abused or addicts parents, regaining custody of their children. So it produces results, so it's effective. I didn't that area that you kind of raised was very interesting to me, because I had not thought of it in terms of how it affects the child. So while there seems to be a based on the research and the study, there seems to be a reoccurrence or relapse in some of these parents that did only one type of treatment without incorporating the medication assisted therapy. I thank you for that insight because I had not thought of it in that way at all, and it was rather interesting watching the pros and cons of medication-based therapy, especially when it comes to addicts or clients dealing with opioid use disorder. That is not to say that it cannot be used for process disorders, but so far so good. It's been more effective than harmful. Are there individual cases of it not being effective? Yes, more cases than not. There might be a few, but it's been more effective than harmful. But each of these treatments is not a one size fits all solution. Each of these treatments is based on individualized care, and each of these brain disorders or mental disorders they are addressing at the moment. And for this case, for opioid use, MAT has been a good way of detoxing and getting them back on track with their families, with their lives, and giving them another chance. Thank you very much.